You want us to all mute ourselves?
Mute you guys, but I mean, I don't have a lot. There's not a lot of background noise or anything, so.
Okay.
We'd like to keep this rather informal so that people can talk and ask questions as we go.
Okay.
But if it gets noisy, then we can mute everybody.
Okay.
It looks like we've got just about everyone except for Avalon.
I'm trying to send her the link again.
Okay.
Okay, and I just text her. Okay, thanks.
So we'll do the welcome slide. So Annalise will just welcome everyone, and then we'll go ahead and put up the slides. We are so thankful to have you all here today. We've been talking about this for a long time. I think it started with Shirley Miller and then went to Laverne, talking about how whatever response a community has should be trauma informed. And as Sarasota Strong has worked with the Neighborhood Resistance Project in Pittsburgh, we are trying to bring trauma informed processes to Sarasota. I'm Betsy Friedman. I'm part of Sarasota Strong. And
I'm Carrie Seaton. I'm also part of Sarasota Strong. And what we'll be presenting to you today is the model for community development and organizing is used by the Neighborhood Resilience Project in Pittsburgh, which is where Betsy and I and several other people from Sarasota trained last summer. So this is actually their training presentation for their COVID-19 response. There will be some modifications made in all likelihood to the local model, but this is just to give you the basic general information and what your purpose is and how you will interact with the community. And we're going to leave plenty of time at the end of today's presentation for you to ask questions, some of which we may not be able to answer yet because the systems might not be totally in place yet. But we welcome your questions because they will, of course, help us develop a system that is that's easy for everyone to use and that's efficient and works well. So we thank you for spending this time with us today. And
one thing, because so many of you are from the Northeast, we do begin with a video from 9/11. So just hold tight to your chairs. I don't want anybody to feel triggered by this. If it becomes overwhelming, just raise your hand and let us know. But we will talk a little bit about that after the presentation, why we're starting there. So Annalise, if you will hit it. Is there sound? Is there sound?
No.
yeah, but there should be. No.
Annalise, you're muted.
She's muted.
Something's wrong with her system.
Can you hear me now?
Yeah. There we go. You have to stand muted.
I was watching a movie.
Still no sound.
At first.
There it is.
And I noticed it was the World Trade Center. I'm a person that can't stand by and watch other suffering. They wanted to get off the island, and there was no way.
You guys can't hear the video?
Not well.
Not well. It's very, very soft and a little garbled.
Well, let's try this. I'm gonna share it straight from
There's
YouTube
no way for them
and,
to get
and
off
see
the
if that
island other
helps.
than the water. And I had noticed when I was watching the television, I saw a lot of, the ferries going up into the slips and taking people off. I said, fine, we can do the same thing.
Better?
I can take people on my boat.
Not really.
Okay,
They have to
Can you
go.
make it any louder?
As loud as it goes. Let's see.
okay. So let's just forget that and go back to where we can all see each other and talk about what this was about. Does anyone recall what happened on 9/11, how people were evacuated from Manhattan Island? Does anyone recall? Feel free to raise your hand and tell the group if you remember. Go ahead, Laverne.
Unmute.
I'm sorry. I'm sorry. What happened and how were people evacuated?
Yeah.
I mean, but my understanding is that they were told to use the stairs and to the nearest exit. I mean, people pretty much did that on their own.
Yeah, and then once they got outside, what happened was the harbor master put out a call to anyone with a boat to come and bring a boat and remove people from Manhattan Island and take them to wherever they went. And there was this huge upswell of support for transporting people. And I recommend you guys watching this video if you haven't seen it before. It is quite remarkable. It was a coming together of people of all types, and people you wouldn't necessarily think of who would be so selfless, and yet they came to the rescue for hours and hours, moving people off Manhattan Island. And so why we started with this is those who respond can get overwhelmed, and the typical systems that we have get overwhelmed. And so depending upon the strong capital in the community and the connections that people make. So you had the tugboat operators and all of these maritime guys who felt connected to one another come and rescue people who just happened to work in that part of the city and some people who lived there. So there was a willingness to organize and on the spot and to figure out how to handle the issue. And what would have happened if there hadn't been the waterway and if there hadn't been this strong network of boats to come and lift people off Manhattan Island? What if that social capital hadn't existed? So one of the things we have to think about as we're moving to help Sarasota Bradenton in addressing COVID-19 is, what is the social capital we need to develop? How are we going to become that strong network to help people through this pandemic? So that's sort of the overview we hope to go through. Carrie, anything else?
Yeah, I mean, I see Annalise has posted the link to the video in the chat area at the bottom of your screen. So when you have a moment, you might want to watch it. It's a very moving video, and I think it really speaks to what we can all do. You know, we may not be part of the healthcare system, but it's really quite remarkable how people respond when, you know, when it hits the fan. I think I have seen that happening already in our community. Some of you may know I also write for the Herald Tribune, and I wrote a column recently about someone who lives alone who was diagnosed with the virus and was trying to go it alone at home and was very ill, but not ill enough to go to the hospital, and was really helped through the whole painful process by a Facebook group that had been put together for around the subject of COVID-19. So I think sometimes we undersell our ability to, because we aren't, you know, technically educated in healthcare, or we aren't part of the system, really sometimes what people need is just someone there saying, I care, you know, it's going to be okay. We'll help you through this. So anyway, I'm sure that none of you would be here today without being one of those people who wants to help. I think everybody remembers Mr. Rogers' mother's advice, which was, in a crisis, look for the helpers. And I can tell that you all are helpers, and hopefully the training that we do today will help you to be more effective helpers. So Annalise, I think we can go to the first slide. So our goal as safekeepers, as helpers, is to combat to slow the spread of COVID-19. As you know, our numbers have been going up really pretty astronomically in the last couple of weeks since Memorial Day. And so it's really important that we do everything we can to start bringing that curve back down again. And we're going to do that by discovering and responding to people's basic needs. So again, you know, I hark back to the example I just talked about of this woman who was at home, and she needed advice on how to treat her fever. She needed food that she was able to keep down. She needed just sometimes a caring voice to say, you're not alone. So these are some of the things that we can provide even if we aren't medical personnel. And whoops, not quite yet. And lastly, because, and this is very much a part of this model from the Neighborhood Resilience Project, and also a part of Sarah Strong's intent, is to always be able to check on how people are doing in their mental health and how they're coping and help them cope.
I believe all of you took Dr. Taylor and Dr. Blanche's course last week, training on responding in mental health. So we're just going to take that in a little tiny bite today, but knowing full well that you've had that other training.
Okay, Annalise.
So you probably know, I think we have healthcare workers on the line that epidemiology looks at how did this illness get started? How is it getting spread? So that we can go to the root and stop the spread of it. And this is for those of you who are on the MHI calls, this is a very important part of what Dr. Lisa and all are trying to make sure happens. We are working with other epidemiologists. Obviously, the data that we get comes from the epidemiologists, but there are flaws in the method. Some labs aren't reporting. Some labs are having difficulties with the tests that they've been given, the material they've been given to use for tests. And we know that the state hasn't necessarily been forthcoming with the data either. What we do know is that this is continuing to spread and is spreading in neighborhoods of color faster than in any other neighborhoods.
Okay, Annalise. So our plan is taking an epidemiological approach to interrupt the transmission, meaning stop the spread, you know, identify anyone who may be symptomatic or potentially have the virus, make sure that they are taken care of and take care of others, keeping them away from others that they could potentially spread the virus to, and ultimately change the norms of the community by building this network of people who care. Yeah. Okay. Go ahead, Annalise. Next slide. the reason to have a community safekeeper in the first place is that if you have already built this network, then when there is an emergency, such as a 9/11, such as a pandemic that was unanticipated, the systems get overwhelmed. And as Betsy said, it then falls to the community and the social capital of the community to step in and fill those gaps. There's evidence that neighborhoods that do have that higher social capital are better able to meet their community's needs.
It's one of the reasons why we're very excited that you have decided to help as telehealth workers, telewellness workers, because the relationships that you may develop with people as you're talking with them may be the most life-saving relationship that person has had in terms of their health and mental health.
And we have a question in the chat from Peggy about what community norms we're trying to change. Well, in this case, in terms of the COVID response, we are trying to, a lot of people aren't aware of the ways this is spread or what exact precautions they need to take. They may not be thinking about the fact that if they gather every Sunday with their entire extended family and one person is symptomatic, that that could potentially spread it to a dozen other people. So we aren't trying to change community norms in the sense of telling the community that anything that they are feel is wrong, but we're trying to provide them with information to make healthy choices.
And part of it too is with the Safekeepers, making sure that people at funerals have masks, making sure that safe practices were followed during Juneteenth. I mean, we still only saw about 25 to 30% of the people had masks on that day. But because the numbers are getting worse and many people know someone who has passed away from COVID, the norm of wearing the mask is becoming more normalized than it had been before. Does that answer the question, Peg?
Yeah.
Okay, next slide on this. So, so the first step in your effort as a safekeeper is to try to interrupt the transmission of the virus. So if you need to intervene to stop unsafe practices that you're seeing. For example, here's an example: you should wash your hands since you just came off the bus. The bus is a place that has a lot of people on it, a lot of surfaces. Just a reminder to someone that might be a good practice. Or if somebody's a little bit too close, maybe we better get a little bit farther apart so we're appropriately social distance. Or if you see someone sneezing into their hands, reminding them, that if they will turn their face into their shoulder or cough into their elbow, just reminding them of the really practical things that we can do that are fairly easy, but that because if you're not carrying that consciousness with you all the time, you just resort back to your common practices.
So these first two are things that the Safekeepers, the outreach workers who are Safekeepers, the ones who are actually on the street, will be consistently doing, trying to share the accurate information and help correct misunderstandings. And you may run into this on your phone calls as well, where if you talk to someone and say, well, I'm not that worried because, I'm only 25, or I've got my mask. I have this paper mask I've been wearing for 3 weeks. Well, paper masks can't really be more than one time. And if you do wear a cloth mask, it does need to be sanitized. or you might not get COVID, but you might get sick otherwise. So, and then also being able to plug into the dashboard and have information to give to people for testing and for other resources. So you will be doing wellness checks, and this to have experienced ladies like yourself calling to follow up with someone like a wise member of the community, really caring for promoting good behaviors, spreading accurate information, and consistently having contact with people who are at risk or are already sick is already changing a norm.
Next slide, Annalise. So a lot of this information that we're going to go over this fairly quickly because I think most of you probably are already aware. This is pretty basic information. This presentation was put together when the pandemic was much newer and people had a lot more questions about what even the coronavirus was. So COVID-19 is the disease, a respiratory illness. It comes from coronavirus disease, so they shortened it to COVID, and the 19 is for 2019. It was first identified in Wuhan, China, but has since spread around the globe, and there is currently no vaccine available, although there's many efforts going on to create one. The latest I've heard is that several are already in people trials, and they're very hopeful that they will have one that will work for at least some of the population by the end of the year or the beginning of next year. And this slide was made fairly early, that saying the most common symptoms are fever, coughing, and shortness of breath. That's very true. But they've since very much expanded the symptoms that people potentially have. I know people who've had gastrointestinal problems, just a wide variety of things that, some people didn't even consider them symptoms of COVID because they didn't match with the fever and coughing. But they have found that it affects different people very differently. As we have found, many people are asymptomatic, which means that they are carrying the disease, but they have no symptoms. And then we have people who are extremely severe and who are hospitalized, who are put on a ventilator. It can, as we know, be very deadly. So, and there's no way to predict, unfortunately, who those people are, who it's going to hit hardest. It does tend to hit older people harder and people who have co-occurring other diseases. If you're over 60 and you have any other health conditions, you certainly are at a higher risk. But it's also been diagnosed in children and has caused some deaths in children. So it's nothing to take lightly.
Does anyone have any questions or comments at this time? Okay.
Okay, next slide, Elmi. And it is, I think you probably are aware of this too. It's COVID-19 spreads from fluid droplets and aerosol droplets in the air when someone coughs or sneezes or shouts or whatever, which is why the whole social distancing thing developed. At least 6 feet apart. I've heard some people say 10 feet apart is wiser. And because those droplets can fall to the surface of something, you also have to be careful about touching something and then touching your nose or eyes or mouth. So it can live on different surfaces for different lengths of time. It's why, again, we just emphasize clean your hands, clean your surfaces, keep your hands away from your face. I have heard people going a little bit overboard in terms of, like dousing their groceries in Lysol and things like that, which I don't think is probably a good idea. But just in general, trying to keep very hygienic conditions, keeping your hands, washing your hands frequently, and keeping your hands away from your face.
Also, obviously, when you're talking to people, the things they might tell you is about it, sharing drinks or going to parties or actually starting up new relationships, which are probably not exactly a great idea at this point in time.
Okay, next slide, Annalise. Thank you. All right. So I just went over this a little bit. Who's most at risk? People 60 and older, smokers, people living in nursing homes or long-term care facilities have been impacted greatly, often because someone who works in those facilities may have contracted the disease and then is caring for this population that is already at risk. And, you know, it can spread like wildfire in a facility like that. And it is indeed where a lot of the early deaths here in our area locally transpired. We had one nursing home in Manatee County that had dozens of deaths. I can't remember exactly how many it was, but again, if you have any other conditions that may have weakened your immune system, or you know, in any way your body is struggling with some other condition as well, that also leaves you more susceptible. Next slide. So again, the really common sense stuff: wash your hands. You're supposed to wash them for at least 20 seconds, which you can sing happy birthday twice, which would drive me crazy. So I prefer to pick some other song, but at any rate, you have to wash them long enough for it to be effective, making sure you keep your hands away from your face, you cough away from your hands, staying social distance. And if you are experiencing anything symptomatic, and even if you're not sure whether it relates to the virus or not, you know, both for yourself and for your neighbors, try to stay distanced from people, at least until you can get a test and determine whether you do have the virus. Okay, next slide. Hand washing, hand washing, hand washing. My son, I said this to my son so much that the first thing that he says when he walks in the door now is, "I just washed my hands." And then before he says goodbye to me, he goes to the bathroom and says, "I just washed my hands again." So hand sanitizer is also useful. It needs to be at least 60% alcohol. And you should wash your hands periodically throughout the day, but especially after you've been in a public place where you may, you know, if, for example, riding on public transportation on a bus, or even going to the grocery store, or if you've just come home from doing some errands and you're going to have lunch, you need to wash your hands very thoroughly before you prepare your lunch. So pretty common sense.
So this is repetitive information that you do all know. And yet, when you have your telephone follow-ups, these may be mantras for you. These may be things that you find yourself saying over and over.
Hang on, we have a question in the chat. This is a question from Peggy. Many people I know are visiting or allowing friends to visit. They feel safe if they have fewer than 10 people in their house. Is this true?
What do you guys think? What would you say in answer to this? Does someone want to field this?
I wouldn't.
I'll take it. I'll take it. This is Jackie Woods. I think that's ridiculous because it's a multiplying effect. If one person in that 10 has been exposed to other people, then they've then exposed 9 new people and multiples of that. And I also want to share this with you real quickly. My mom lives in an ALF in her own apartment that we put her in 2 years ago. She's 96 years old. She has her own staff. She doesn't have the staff of the ALF. She has a private duty 24-hour staff that comes at a very expensive price to our family. And my mom, someone in her staff brought it into her. My mom now is at Sarasota Memorial Hospital, 3 blocks away from me, dying, and I can't see her because they won't allow anyone in. They won't allow her staff in. They won't allow us in. And so anybody who thinks they can have a little group of 10 people on their lanais and social distance, they're fooling themselves. Because anytime you bring anyone into your environment that doesn't live in that environment with you 24 hours a day, they're putting all of you all at risk. So that's my opinion on that.
Jackie, thank you for sharing that, and our heart goes out to you. I recently wrote another story about a woman who is also in an ALF, whose daughter has, his family has been unable to see her, and that's a situation that so many families are experiencing right now, and it's so painful on all sides that people can't be together. And that actually brings us to our next point about keeping your distance is so important. But we also have to remember that, as human beings, we're social animals by nature. We are drawn to being with each other. So we have to get a little bit creative about how we can ensure that people aren't lonely because they are physically isolated or distanced. I know in some ALFs, they're allowing families to have window visits where they can sit outside the window and speak on the phone and see their relative through the window. Obviously, it's not ideal.
They're on the 3rd floor. You can't have a window visit. So it depends on where their apartment is.
And we try to use the technology we have, like FaceTime or Zoom or whatever. It's very important that people who do have to be distanced because they may have or potentially have the virus, that they aren't left feeling completely alone and lonesome. And that's where you all will play such a big role with your wellness checks, not only providing them with information about, how to care for themselves and care for the people around them, but just to be that voice
and that compassionate ear.
Yeah, exactly. I mean, the woman who I wrote about who went through the illness alone at home, at one point her fever spiked very high and she called 911, and the EMTs came to her home, and they didn't, they did all of the testing and so forth and decided that she didn't meet the standard to be admitted to the hospital. But when you talk to her now about her whole illness, she remembers that as being the high point of the time that she was ill, just because she had caring people there who were kind to her and who were concerned about her. So I think we can't say enough what an important role you will be having in terms of being that caring, compassionate voice.
And Jackie, I just want to say I'm so sorry. And if we could take the story that you just told us and get that out for people to hear, I think they would think twice about having gatherings.
Absolutely. One thing I can tell you as someone who's been a reporter all my life is that what tends to stay with people are stories of other people. I mean, you can give them all the facts and figures in the world. You can try to scare them with percentages of people who've died or whatever. But if you tell them one story, like the story that Jackie just told us, it will stick with them with much more impact. So again, Jackie, thank you. And we'll be praying for your mom, and thank you for sharing that.
Well, thank you for listening.
Okay, Annalise, next slide. So obviously everybody is stressed out right now, and probably even more now than when these slides were created, because that was at the beginning of the pandemic. And I don't know how it was for all of you, but when those first weeks when we realized this was really serious, people took it pretty seriously. I mean, you could drive through Sarasota at 9 o'clock at night and not see another car. I mean, people were really staying home, staying distant, staying, safe. And now we're, 4 months down the line, and people have been cooped up at home for that time, and they're more stressed out than ever. And stress can take a lot of different forms. It can show up as anxiety about getting the illness, or about family members becoming ill. It can change your sleep and eating patterns. It can keep you from concentrating. It can even make you, physically sick, obviously. Or it can push you to our already unhealthy habits. I mean, somebody was talking the other day about the COVID-19, as in the 19 pounds you gain from staying home and eating all the time. So, we have to be aware when we make these calls and these wellness checks that people are stressed out. And our role is to try to be that calm voice of reason that will help them settle down. Okay, next slide. So you will be, when you do these telephone wellness checks, you will be asking people a series of questions to assess whether, they may be exhibiting any symptoms, whether they have other issues that are arising in their life that are stressing them out. So for example, you might say, have you experienced any significant changes in your eating or sleeping habits? Is the virus and worrying about the virus keeping you from doing things that you want to do? Have you increased your use of tobacco or alcohol or drugs since you've been cooped up at home? And do you have any specific concerns about your mental health? Are you feeling depressed? Are you feeling lonely? Are you feeling, isolated? Do you have anyone to talk to? And if you're a person that, obviously these are delicate questions and you can't just blurt them out, but once you have established some kind of a rapport with the person you're speaking with, you may want to just generally, I see something popped up from Marilyn in the chat. Are we to ask these specific questions? I'm gonna ask for Betsy's advice on this. My advice would be no. I don't want you to go down a checklist. And, I think you need to be intuitive in the sense of, how does this person sound like they're doing? Are they struggling? And then be very delicate about asking. I mean, obviously, you're not going to ask somebody that you don't know. So, are you doing more grass? More pot lately, or
Grass? What are you, a hippie?
Grass. I'm a hippie. I dated myself. Look at Annalise, can't even believe I said that.
There's another one. So, by show of hands, who already took the course with Dr. Taylor and Dr. Blanche? Who on this call? Aliyah, did you? Is that Aliyah?
I took it as well.
Okay, so they gave you information about being sensitive to that. If I'm not mistaken, is that the case?
They did, but my question is, is it something that you should ask openly or no?
How did they tell you to do it?
They said sort of if it comes up, then to deal with it, not to ignore it, not to shy away from it. But
right. So in the course of a conversation, hello, how are you doing today? Thank you for thank you for inviting me to call you. What made you think that was a good idea? How, what's on your mind today? How are you feeling? And just general kinds of conversational things with open questions where they might be likely to be really grateful to have someone to listen to them.
Hi, Betsy, this is Laverne.
Hey, Laverne.
The Link Sisters, we did not have the training with Janet Taylor.
Oh.
Yeah, so because it was the timing, but I've have spoken to her and she's going to do something for us and repeat the training.
Perfect, because they go into depth, really good depth about that specific part, which is so critical. We're generally giving you the 30,000-foot view of these are the kinds of things that you will be doing as you talk to the people, and they will give you the specifics of the how.
Yeah. I spoke with Janet yesterday. So yeah, so we'll get to that training.
Okay, perfect. I'm sorry, I was mistaken. I thought that you had done that. Thank you. Are you talking about domestic violence and abuse? Yeah, they address that as well.
Okay. Yeah, and I'm sorry, I kind of blurted into this as if this was standard questions. I wouldn't feel comfortable asking any of these very directly until I had established some kind of rapport with the person. However, when you're saying, so how are things going? And they may say, oh man, it's been really stressful. My husband's drinking too much, or they may reveal information. And so, you want to be first and foremost a listening, compassionate ear. And then I'm sure that Andy and Dr. Taylor's training will help you in terms of responding, such as, would you like some information on a place that you could call for some, help with, whether it be depression or, fear in the home or whatever. I'm sure you will be provided with more specific information on how to handle that.
And as Peggy just pointed out, a lot of you have experience as social workers, mental health backgrounds, nursing. You're no stranger to the issues that come up when you're talking about community wellness.
Okay, I think we can go to the next slide, Annalise. So we have limited mental health resources locally that are actually accessible all the time. Centerstone, which is the behavioral health hospital in Manatee County, has a 24/7 care line. That is the number. You will want to have that number handy in case someone does want a referral, or you may even have to make the call for them yourself if that person is in crisis. But they can refer you, they can refer someone to a mental health counselor. If it's a more extreme situation, they have an outpatient center in Bradenton where you can go and get an immediate appointment. And they can also, they're doing a lot of stuff by group sessions by Zoom right now. I happen to have a work colleague who at the beginning of the pandemic experienced severe anxiety to the point that, he's a reporter and he's supposed to be reporting on the virus. And he got so anxious in trying to do that he was having trouble breathing, and I ended up taking him to Centerstone, to their outpatient service, and he did get to see a counselor. She was very thorough. I was really quite impressed with, it was a long wait. I'm not gonna downplay it, but it is a good organization that does have a lot of help available.
Marilyn just asked, where will the names of the people we call, whoops, sorry, that's okay. Where will the names of the people we call come from? Will they know we might be calling them? The Safekeepers and the MHI scholars and are working together with us to develop those processes. We'll get to another screen where we will discuss what that process is right now and how it will be tweaked. So we're getting there. So go ahead, Carrie.
So just to finish up with this slide, again, unfortunately, there are not a lot of, the systems, our mental health and healthcare systems have been so overwhelmed by the pandemic that they're kind of doing what they can do, but there are a lot of gaps. So I know, for example, calling the Department of Health with questions can be very frustrating because they really aren't set up to handle, to be a hotline. So, I think this is obvious, but if you do encounter someone who is you're very concerned about in terms of them hurting themselves or having a real mental health crisis, of course, you're going to call 911. Okay, Ellen. So here, these are some national numbers that you also might want to have on hand. SAMHSA, the Substance Abuse and Mental Health Services Administration, has a distress hotline that is particularly helpful for someone who's struggling with substance abuse. There's the suicide prevention line. I think that I just read that they just created a national 3-digit suicide number. Is it 311?
I don't know.
I don't know. I'm sorry.
We'll
We
get
should have
that
checked on that. But yeah, I think there's now a 3-digit, like 911, but it's for suicide prevention. I believe it's 311. I want to really recommend the third suggestion here, which is the crisis text line. It actually, crisis text line was created by the daughter of some friends of mine who live here in Sarasota, the Lovelands, and it's had an amazing impact, especially with younger people who are much more willing and eager to text someone rather than actually to call a hotline. And they have people available 24/7 with text support. And it is now a global phenomenon. I know in the United Kingdom, the royal family has gotten behind crisis text line, and some of them have even been counselors on the text line. So I think especially if you're working with someone who is younger, who may be less eager to call someone who wants or someone who wants a particular level of privacy, I think the crisis text line is a great option.
So this is not something you need to commit to memory. There is the Sarasota Resilience Dashboard. Have any of you actually looked at that dashboard or is this the first you're hearing of it? Laverne, I know you know about the dashboard. Has the rest of the group seen the dashboard?
I haven't.
Okay. So, she's muted. Laverne, you're muted.
What our process was going to be after all of the training was done, and we have directions on the outreach, was to actually have an orientation for the links and have someone like you, Betsy, or I forgot the other lady's name, can kind of go over the kind of do a review of the dashboard.
Perfect.
Particularly information, around the data, kind of keep people abreast. So what our process was going to be sort of like have the training from you all, and then have our link sisters trained as to how we're going to do the outreach, and also provide an overview of the dashboard, and even have Lisa talk to the link sisters before we start doing our outreach. So
perfect.
like a process. So
great.
Yeah.
And I saw that Aaliyah just posted the link for the resilience dashboard on the chat section here. It's I think a really good idea, even before you have that training, to just go on there and kind of browse around a little bit and look at what's there. There's a lot of information packed into that website. So just take a look and familiarize yourself a little bit with it so that when you have the training, it will be the most effective for you. And I think we can go to the next slide on this. So, you know, there are some pretty obvious things that that we can do to help de-stress ourselves from the, you know, the overwhelming pandemic everywhere all the time a situation. I think they're pretty common sense, but obviously, you know, take a break from the news media, television, and social media. I have a friend who obsessively watches this stuff, and then her anxiety level goes through the roof. And it's like, stop, just stop, go take a walk, go do something to promote your health rather than your anxiety. So it's especially important during this time, and you'll need to emphasize this with the people you talk with in terms of them taking care of themselves. Everything from trying to eat well and get enough sleep, to planning some things that are enjoyable for them, even within the restrictions of the pandemic. I, very early on, my sisters, I have 4 sisters, and we set up a twice a week yoga session that I teach online. And that's just been a wonderful thing for me during the pandemic, to just very regularly bring myself together with the people I love and doing something healthy for my body. And that's been a real lifesaver for me. So you want to encourage others to connect to other people in a safe way in order for them to feel well supported. And whatever your, you know, whatever your faith is, whatever your practice is in terms of prayer or meditation or mindfulness, those are things that we really need to make a priority right now. Even before we get on with our work or our families or whatever. It's like Father Paul would say, you know, it's that thing about, you know, put your oxygen mask on first before you put it on your children. You know, you can't help anyone else unless you're in good shape yourself. Next slide.
So we know that there are issues in the beginning of the pandemic with mental health concerns, but as this goes on, and we may, or yeah, you want to say that again? Okay. We know that we have to maintain our wellness if this actually does come to an end. So there are 2 concepts that you would be able to use for yourself and for those to whom you speak, which presencing and purposing. And these are just, Annalise, you can go to the next. Presencing are ways to calm. So you all are social workers, some of you are mental health workers, some of you are nurses. You may know this, but let's take a second to do this. Let's ground our feet on the floor. And are you humoring me? Are your feet on the floor? Hands on your lap. All right, shut your eyes for a sec. How do you feel? Is there tension anywhere? Any aches and pains? What do you need? You know, you all are overachievers. I'm sure you're Zooming and working and helping 24/7, but remember to stay connected with yourself and to give yourself what you need and to help the others who you speak to do the same. Yeah, you're going to stay connected with families and friends, but it can get overwhelming. So if you're invited to that 27th Zoom call for the week and it's important, maybe you can just say, you know, I'll catch you next week. Make sure to find those things that make you laugh and smile, and really pat yourself on the back for all that you're doing to support yourselves, your family, your community. You've got these skills and you're using them. Jackie, you're here despite the adversity you're going through because you want to make it better for other people. And that's incredible. Recognize yourselves as the social network that you have. The Links are an amazing group of women, and you all have other social supports outside of that as well. Try not to be non-judgmental. I don't know about you guys, but I'm finding my thoughts are not as filled with gratitude and sweetness and light as they used to be. I have to work on this one a whole lot more, maybe like pray 24/7. And I'm trying to show myself the same kindness and compassion, but I am a little frustrated, honestly, with, you know, not being able to do all the things that I'd like to be able to do. So I'm trying to treat myself as I treat somebody else at this point. And maybe that's what we overachieving women have to do. Does anyone else have some other hints about presencing that you like to use?
What do some of you do to when you're in that place where you feel your stress levels rising and you need to, you know, take it back down a notch? Are there specific things that, I mean, for me, like I said, yoga is a real plus. Is there other things that people do regularly that helps them?
I'm in my garden all the time. I need sunshine. Like I feel like being in the house just kind of compounds that feeling that I get. So going outside in my backyard, just in the sunshine, feeling that on my skin, digging in the dirt a little bit, like that brings me back to earth and gets me grounded.
Yeah, great. Anybody else?
This is Jackie, and I've always found that for me, the best thing has always been to do something for other people. It gets my mind off of me. And I think it's also very important, for at least for me, to always have to show gratitude for what has occurred in my life. I have a 96-and-a-half-year-old mother who has had no major health problems her whole life, and my father died when I was 16, and my mom never married again. So I'm one of 4 siblings, and I'm the baby in the family, and that's actually what we've been doing with each other on a group text, is just kind of talking about good things. I think that shut out bad, because we're so filled right now in this country with so many things that we can focus on that are negative, and those really do, to me, they're acid, they're acidic. And if you can kind of just focus on the positives that are in your life, it really is healing, and also to help other people, to be there for other people. I think that's the best medicine that you could ever have.
Well, funny you should say that, because it's a perfect segue to the next screen, which is purposing. Find ways to find your meaning, your inspiration, and your hope. Really understand why we're here and why we're doing what we're doing, and finding purpose in helping others, which I think probably every single one of us on this call do. So there are additional options to try to learn new things about ourselves and others. Really acknowledge what we're learning from this pandemic about ourselves and others. If you're a writer, journaling about your values, identifying additional ways to try to help that maybe we haven't done before, and make choices that will definitely improve your own well-being as well as that of the community. And try to stay grounded with joy, embrace that one day things are going to be better.
Yeah, I was just going to add that I think it is really easy to unconsciously get caught up in not just the alarm over the pandemic, but we have this last 4 years of the current administration of the country has been very tumultuous as well. And I think it's really, people have been very hyped up and very partisan and very, no matter which side you're on, there's been a lot of tension and drama and negativity around that. And I know it's been particularly hard for me as someone who works in the news business to, recognize that you've got to step away from that and really come back to what are your personal priorities and who do you want to present as in the world, not kind of being absorbed in all of the negativity around you, but maybe choosing something different for yourself.
But also with the strides that could be made to increase equity at this point in time, I think that there is a lot of purposeful work to be done. And I'm optimistic that things are really going to get better, that all of the protests and all of the acknowledgement will not go to the wayside, that this is truly a hinge moment period in history. Go ahead.
Hello, Marilyn.
Hey,
Can
Marilyn.
you hear me?
Yes, ma'am.
Yeah.
I love everything that you're saying on these slides, and I can really fully support it. But I think one of the things that's going to be real important when we're talking to this audience, and I'm assuming that, since links, we are focused on the African American community, we're going to really have to put this in language that our community can connect and relate to.
Mm-hmm.
And in our community, there's a lot of focus on certain sayings: let go, let God, count your blessings. I mean, I think we have to bring that to the conversation so that we can really connect with people. And I just wanted to make sure that, one, we spend some time, maybe not at this session, but maybe with a session with Dr. Taylor or whatever, we'll really focus on the cultural piece of communicating to the group that we're focusing our help on.
That is I'm so glad you said that, Marilyn, because, Betsy and I are two white, middle-aged white women. And that's why we are not doing the calls, because we are not the right people to be doing the calls. That's why this whole model is built around having people of the community, of the neighborhood, of the culture, be the ones who make the contacts, because that does make an enormous difference. They are going to be open to hearing you. You speak their language, you understand them and their, where they're coming from. And it will not feel to them as if you're trying to impose something on them. It will feel more to them as if you are reaching out a hand to help them. And so I'm so grateful to you for saying that, because that's an incredibly important point.
So go ahead, Annalise. So again, to review, the whole idea, the big overarching idea is in keeping people safe from the spread of COVID-19 is to identify if we suspect the person might be positive, to help people understand that they need to isolate if they're feeling poorly, and to inform people about where to get tested, how to get tested, and how to keep themselves and other people safe. So this is the portion that you were asking about before. As of now, this is the very, very general description of the telewellness process. A safekeeper outreach worker, someone who is out on the streets, will request a wellness check for an individual or family to will make make a request of one of you, a telephone bank volunteer, that you provide a wellness check for an individual or family. And then there are the short surveys, which you'll be given to fill out, which you don't have to give verbatim, but can do in a conversational way. The surveys now reside on the resilience dashboard, but if that's really not convenient way to have them provided to you, we'll have to find another way. But the surveys and the health assessment will get filled out during the course of a conversation and will be returned to Multicultural Health Institute on a Google Doc. The ideal would be that you would check in with the folks that a Safekeeper has asked you to check with 24 hours, every 24 hours during a crisis and 72 hours thereafter. Any needs that you discover, we'd hope that you would connect people to services, but if it's food, if it's masks, if it's tangible things, there's a place on the dashboard for we have and we need. And then MHI is going to be the pivotal point, the center of maintaining the records and making sure that resources are obtained and distributed. So Aliyah, does that sound about right? Is there anything you'd like to chime in on right now?
Yeah, so when you fill out the survey, it auto-populates all the information to a spreadsheet, which we are actively monitoring. The scholars are monitoring, and Barb at the MHI and others as well. So, and then we will get the supplies or the resources or whatever is needed to the right safekeeper in question to be distributed. Yeah, so if the survey is on the dashboard, it's going to be updated soon with some questions about hurricane preparedness and hurricane supplies too. We can also do paper surveys. If the dashboard is not the most convenient way, we can just provide paper surveys printed out and then someone can come by and collect them. So that's an option too.
So as Laverne mentioned, there will be a final training after Dr. Taylor and Dr. Blanch's training. And so I assume that all these processes will be worked out during that training.
Yeah, there's still kind of, I know the getting it to the Safekeepers is still kind of something we're fleshing out.
Sounds good.
Right.
Thank you.
And again, I just want to reiterate that the survey is on the dashboard, so anyone can go on there and fill out the survey. But of course, for a lot of people, internet access may be an issue. So you may need to, interface with the person that you're speaking with, that you're doing the wellness check. And if they haven't done the survey, you may have to do it in a paper form or enter it onto the dashboard for them.
Okay. So you all are professionals. You all know how to make these calls. You will be calling up, introducing yourself. You'll tell them where you're from and that you're not a healthcare professional. And you will ask permission to begin the wellness assessment. If any of you know motivational interviewing or similar communication styles, those become very helpful in just meeting the person with compassion and offering them the opportunity to tell you where they want to go with this phone call. If they wanted someone to call them, they probably had a reason for that. And so even at saying to them, thank you for taking my call, what made you think this was a good idea, might be a really good open to getting closer to what it is they would like to talk to you about. So we do have the COVID-19 and travel questionnaire that can be given as well if you suspect that there might be a need for this at the time. This is really something the outreach workers will probably use more than telewellness folks. However you ask the questions, if you say to someone, how are you feeling today? Do you mind if I ask you a few questions about your symptoms? Do you feel warm or hot? Do you have a cough? Are you short of breath? Do you have abdominal pain? You know, just to make sure, and then to record them. Again, the MHI scholars, the Safekeepers, and Dr. Lisa have been working on the very specific screening, so it may look different, but there will be a screening that you will have to check yes or no on, and then submit that information back to MHI. Aaliyah, chime in anytime if you'd like to.
I know, have people here done the contact tracing course?
No.
Okay, so one of the things from the contact tracing course that they really emphasize is asking open questions and trying to avoid leading questions. So instead of saying, do you have a fever, or you're not feeling hot, are you? You would say, what sorts of symptoms are you having today? And you leave it open for them to explain, and you ask for more clarification, so you prompt them. So that's just one thing to consider too.
That's great.
Yeah, that's great advice.
Okay, so you will be trying to identify, once you have those responses, excuse me, then of course the conversation will lead into needs.
Well, first of all, sorry to interrupt you, Betsy, but if there are responses to the health assessment, and this person has not yet been tested and doesn't know their virus status, it's very important that you stress to them that they need to be tested and that they need to isolate until they receive the results of that test. They may not be familiar with where they can test. And all that information is on the dashboard. There are 2 community health sites that are no appointment, that the one at the UTC Mall and the one at the Robert Taylor Community Center, but there are also a number of other pop-up sites that you can find through the Department of Health that are appointment only sites, and most of them are drive-through sites. So it's really critical that if they are feeling badly, but they have not been tested, that you make sure that they do get tested. And if they don't have transportation, then I would go back to the Safekeeper and say this person needs transportation to a test site. And very important also, I think, to stress to them that if they are symptomatic, they may think, well, I'll go get the test, but I don't really have to be careful until I find out whether I'm positive or not. I think if they're symptomatic, you need to be sure to impress upon them that it's very important for them to consider themselves possibly a source of transmission until they have the test confirmed.
What was that?
Not everyone's living. Not everyone. Peggy noted that not everyone's living situation allows for isolation, and we'll have to offer them the next best solution. That's absolutely true. There are often households with multiple people living there. I think it will be important to try to help them understand that they need to isolate to the degree they possibly can within their own living situation. So I know families where one person in the family has tested positive and has isolated in their own room for whatever the remainder of the quarantine period is, and the other family members, brought food and left it at their door. It's not a great situation, obviously, but to the degree that they can, even within their family situation, and to protect their other family members, they do need to try to isolate.
So I think we just talked about that. Yeah. And then closing the information loops. You all know that in order to truly help the person, yeah, there's the paperwork, but there's also that immediate need, and explaining with reason, setting reasonable expectations within the person, of how you might be able to help, and making sure that the outreach safekeepers are plugged in very quickly and that you're staying in contact with them, so that person who you are talking with is served in the very best way possible. These talking points we have talked through about how, you know, how we, things we might say to people, of course, whether or not these make sense within cultural context, you know better than we, but the general meaning, you know, and stories like Jackie told will be really critical to share with people. Again, this is an example of a telephone script, which Aaliyah and the group will be providing to you, which you don't have to stick to, but it's a general format.
And that was for a follow-up call.
Yeah.
So after perhaps someone has been diagnosed, you want to go back?
No, that's okay. Your script, your follow-up call will be different from others. And, you know, we don't know at this point how long the length of your relationship with the person may be, but that will be another thing that you'll discuss in the training with Dr. Lisa. So remember to take care of yourself as you are doing this work. It's really easy to get caught up in the great need that some people have. So doing all the things you do to purpose and presence yourself will be critical to keep you going. Do you want to elaborate? Okay. So
is there more?
No, we're at the end.
We're at the end.
So if you haven't noticed, this is the first time Carrie and I have done this. Normally Father Paul and one of his assistant priests would be doing this, but they're very, very busy in doing the work in Pittsburgh. And rather than not prolong this training any longer, Father Paul asked that Carrie and I step in and do it for him. So thank you for bearing with us today in our first attempt.
And clearly we, you know, we are finding our way as well. And, you know, there is also the aspect that some of these systems and processes have not been finalized yet. So in terms of providing you with the Google Doc or the specific health assessment questions, those are still to come. But we at least wanted to try to get you started on, you know, what the expectations are for you as telephone bank volunteers, and so just some things to be aware of and keep in mind, both in terms of your interaction with the people you call and taking care of yourself as you're doing this very important but challenging work. I feel like, as Marilyn said, you know your community, you know your neighbors, you know the culture. You are going to be awesome at doing this. So I feel almost a little bit foolish having us telling you what to do, because I think that you are much more sensitive to the issues in your own community, to the challenges among many of the families in your community. And you know, as long as you are open and sensitive and listening and caring, I know you'll do a great job.
Any other?
Well, Carrie, Betsy, and
Annalise.
Sorry, Annalise. I'm sorry. Thank you also very much. It was very informative. I will be following up with Lisa and also with Janet for the mental health piece training. And I know there was a call yesterday evening with the community groups. I had the wrong link, but I'm waiting to hear the recording so I can catch the group up as to where we're going with the process, with all the community organizations starting to come together around the Safekeepers outreach piece. So I'll be sharing that with our group, and we continue to look forward to work with MHI and the Safekeepers. It's an excellent process. I'll be on the call tonight to hear all the epidemiology and very informative though. I think you all doing an excellent job. I'm working with the Multicultural Institute and Dr. Hill and all of the different organizations.
It's an incredible collaboration who's
yes,
talking.
yes. And as I was explaining to someone yesterday about the whole project, you know, we were, you know, just when we thought we was getting ready to move to phase 2, then we see this influx of numbers of more positive patients in Manatee and Sarasota. So you almost had to kind of push back just a little bit to, you know, just accommodate what was going on in the community with the escalation of the number of cases in Manatee and Sarasota County. But I was glad to see the email that came out yesterday morning with all of the different projects, I mean, the steps now, and where we're going with the Safekeepers outreach piece. So we are moving into phase 2. And you know, I know the epidemiology and the data is always very important, but when you can really connect with the community and work with the community about this, I mean, it's even better because that's the prevention piece of the disease process. So we thank you so very much, and I'll be on the call tonight.
Great. Carol?
Will you be sending us a copy of this presentation?
Yes.
Yeah, it's been recorded, and Annalise, do you know how people could access that recording if they wanted to?
Yes, I will send them all.
Could you maybe, well, I can't hear you.
I will send everyone a link.
Okay, good.
So Annalise will send a link back to this presentation. Just before we close, is there anyone who has a question or wants to comment on anything? Betsy has something.
I have one more thing to say. As we move forward to phase 2, there will be a group that maintains relationships with the community, talking about very specific chronic conditions, and really maintains that health and mental health connection. As Sarasota Strong is working with a group called Moving Forward, who will be actually doing trauma-informed community development work. This is a group of people who have grown up in Newtown, who have a great love for Newtown, and they will be working to build micro neighborhood groups and strengthening the groups within 4 quadrants of Newtown, and beginning to organize and improve, increase the social capital that has the potential to exist in Newtown. And that group is Becky Shelley, who has been around for a long time. She has 5,000 Facebook contacts. Latrice Preston, who is on the police advisory board now, and Jameis Johnson, who works for Tom Barwin. They are 3 amazing women. And we're also working in conjunction with Dominic Harris, a detective with the police force who has many community projects going in Newtown as well, as he was born and raised there, among other folks. So we'll continue to parallel the work of MHI, but moving into the actual physical built environment and into other structural issues, and a little bit more away from the health and mental health side, even though we will be addressing trauma and systematic racism and generational trauma as we work to build strength within the neighborhood.
Yeah, and we hope you'll all consider yourself part of this network that we're trying to build within your neighborhoods, within your community, because yes, the current crisis is the pandemic, but as you all well know, there are many, many other issues within our communities that we need to address. And the whole effort of Sarasota Strong in that sense is to empower the community itself to make choices about how to address the problems within it itself. And so, you are all incredibly valued members of that network, and we really would welcome you to stay involved even after this current crisis has passed. Anything else? Any other questions, comments? Thank you so much for bearing with us newbies doing this.
Bye.
Everybody-
Okay.